Cognitive behavioral therapy. The key figures of CBT are Albert Ellis. He had a psychoanalytical training, but he soon discovered that his traditional psychoanalytical practice wasn't effective. So he created a different approach, the rational emotive behavioral therapy. There are 5 components to Ellis' approach. 1. People adhere to irrational ideas and personal philosophies. 2. These irrational ideas cause distress and misery. 3. These ideas can be boiled down to a few categories. 4. Therapists can find these categories in their clients' reasoning. 5. Therapists can teach clients how to give up their misery-causing irrational beliefs. Ellis was one of the biggest characters in the history and practice of psychotherapy. After Ellis, another formal cognitive approach entered the scene. Aaron Beck was also psychoanalytical trained. He ended up rejecting Freud's theory and explaining his own theory. Beck's theory of depression is one of the best known and most scientifically supported. Beck recognizes that focusing on this other stream of consciousness was more valuable than free association. Cognitive therapy is not interested in rational arguments with clients. Instead, the therapist works together with the clients to help them discover the maladaptive nature of their thoughts and beliefs. Beck emphasizes on collaborative modification of thoughts. Donald Meichenbaum noticed that people on the streets in New York City would sometimes talk to themselves. He discovered that children and schizophrenics, similar to people in New York streets, could improve their functioning after being taught to talk to themselves or to think aloud. His style is collaborative, empathic, and emotionally oriented. He's redefining cognitive therapy as an integrational approach.
Based on a book by Judith Beck, there are 10 main concepts and principles inherent to cognitive behavioral therapy. The first is that cognitive behavioral therapy considers the client unique and their circumstances are constantly shifting. The second is that a good therapeutic alliance is needed for cognitive behavioral therapy to be effective. CBT emphasizes a collaboration and a participation, not just passive learning on the part of the client. The client must be engaged in order to reap benefit from this style. CBT is goal-oriented and problem-focused. It does not often concern itself with the past circumstances of the client or with their own perceptions of those events. CBT puts emphasis on the present rather than the past, and emphasizes the client's interaction with their present to achieve their future. CBT utilizes psychoeducation and tries to foster independence within the clients. CBT seeks to be time-limited, meaning that it shouldn't take more than 2 years before benefits are seen. Individual cases may vary, but if the client is not actively benefiting, a different style is needed. CBT sessions are more structured in that there is a goal. It is not often just general discussion, it is discussion with a purpose. CBT seeks for patients to identify, evaluate, and respond to their own dysfunctional habits. Rather than being reliant on a therapist, this fosters internal resilience. And finally, CBT uses a variety of techniques to facilitate change and progress. A therapist correctly using CBT should not seek to only use one theoretical perspective or only one certain set of techniques for their clients.
For CBT, the view of psychopathology centers around the negative thoughts and beliefs that we carry around in our heads. Ellis believed that psychopathology stems from irrational beliefs and absolutistic thinking. So this involves dwelling on how things should or must be, which Ellis referred to as masturbation. Ellis combated these thoughts by challenging clients to let go of that definitive way of thinking. Beck believed that psychopathology comes from cognitive distortions or faulty assumptions and misconceptions. These can be triggered externally, like from a bad breakup, or internally from something like a drug reaction. These distortions produce automatic thoughts or thoughts that occur on their own as a reaction to a trigger. So if a kid is struggling to learn how to ride a bike and he sees other kids riding bikes, this might result in automatic thoughts about how he is not as good or capable at physical tasks as other children. These automatic thoughts become tied to our core beliefs or schemas, which formulate our own perceptions of ourselves. Beck also developed the negative cognitive triad to explain how depressive symptoms develop. He believed that depression stems from a person's negative evaluation of themselves, the world or specific events, and the future. Self-instructional theory believes that psychopathology comes from dysfunctional inner speech. So this could be something like telling yourself, oh, I can't do this, or this is too hard, before you take an important test or give a big speech or something. So counselors could help with this by teaching the client positive or adaptive self-talk strategies, or mentally talking to yourself in a more positive way. So while it takes extensive training and supervision to become competent in CBT, the basic procedure involves first accessing the client's irrational or maladaptive thoughts or dysfunctional inner speech, so the negative ways the client is thinking about themselves or situations. Then instructing clients in more adaptive or more rational thinking, which can involve teaching the client several verbal coping strategies. Finally, the therapist should support clients as they apply these new and developing skills in their lives. So this could involve something like giving them homework assignments where they monitor and write down their automatic thoughts as they come up, and going over these thoughts with them in the next session.
CBT is considered to be culture and gender blind. For most CBT therapists, culture and gender are not of primary significance. There is a positive and negative side of this. The positive side is that the therapist is equally committed to the well-being of a client who's part of the dominant culture as he is to a client who's not. The negative side is that CBT can be viewed as blaming their clients for their symptoms, even though the symptoms might be a reflection of gender and culture bias. Awareness of the possibility of blaming the client for symptoms that may be a reflection of their culture is a first step towards gender and cultural sensitivity. The efficacy of CBT is well documented. There are two main lists that categorize treatment as well-established, probably efficacious, and possibly efficacious. From 29 treatments listed as having well-established efficacy, 26 are behavioral, cognitive, or cognitive behavioral. And from 33 treatments listed as probably efficacious, 25 are essentially behavioral, cognitive, or cognitive behavioral.
During the mock session you are about to see, the therapist will begin by questioning the client about their own perceptions of what is happening to them. Using a simple cost-benefit analysis, the client will compare the benefits of how they react and think to the costs of those same actions. As the client acknowledges the harmful quality of their symptoms and thoughts, they and the therapist will then begin to use the next technique of discovering double standards. As the therapist asks more questions to draw out the client's understanding, it will become clear that their thoughts are biased against themselves. These techniques are designed to help the client realize how they are spending their cognitive energy and find better alternatives for how to approach life circumstances.
All right, so for this role play, I'll be playing a client that has lost his job and has been having trouble finding employment. He's now begun to doubt himself a little bit and feel a rising sense of hopelessness whenever he thinks about not working or trying to find some work. Some of the symptoms he's been experiencing: fatigue, self-doubt, lack of energy, declining motivation, and some anxiety about the future.
We chose cognitive behavioral therapy because of the many studies and articles that speak to how effective CBT is with depressed and/or anxious populations. CBT has also been effective in treating populations struggling with unemployment, social pressures, and constant maladaptive behaviors or thoughts. The client was chosen, 1, because of how CBT works with these populations and has been proven to be efficacious with them, and 2, because the problems of depression, unemployment, and anxiety are very common in the general public. Approaching these issues in our mock session offers a glimpse of how CBT can help with such problems. These types of issues can also be greatly helped with psychoeducation regarding self-control and/or increasing autonomy in the client. Hello and welcome back, Jared. How are things progressing in life?
I've been feeling more and more tired recently. I haven't been wanting to get out and do much of anything. I'm really worried that the longer I go without a job, the harder it will be for me to find one. Every time I go into an interview now, I start to feel that I'll just fail again and they won't want to hire me. And I start to get really nervous before the interview, that I feel disappointed and worried for the rest of the day afterwards.
Hmm. Do you still feel that you have a chance to find a job?
I don't know. I doubt myself more than I used to. Every interview or job application feels like my whole future is riding on it. And I failed the last several, so I'll probably just fail at the next ones too. I swear, like the interviewers, they can just tell that about me. Like they already know I'm nervous and bound to mess up or say something wrong. So I don't know how to feel confident about getting a job anymore.
Mm. What would getting a job be like if you didn't think you were going to mess up? If you thought that the next interview would go, it would go well and that you'd find a job again?
Well, I guess I'd feel more confident about myself, more hopeful for sure. I wouldn't feel like every interview is the last chance I have, or that failing to be hired is the worst thing in life. So I don't know really, because I always feel that way, that the world is riding on this one interaction that I can't get right.
What about when you got hired at your last job? Did you feel the same way?
No, I felt really right for that position. There wasn't really anything that could stop me, and I even applied twice for it, since the first time my application didn't even get looked at. So the second time I came in personally and talked to the management about the position being offered, and they were so impressed by my drive and desire to work that I got hired within the next few days.
Now, what if you approached your next interview like you approached that one? Never mind the confidence, because I get that you're nervous right now. But if you looked at the next interview as though it were for your old job, what might happen? What if you weren't so sure about what the interviewer might think of you?
I actually don't know. I guess I could get hired, but I don't know. Though you're right, because I don't really know what they think of me during the interview. It's just how I feel about the whole thing that makes me think that way. But without those thoughts, I think I'd make a good first impression and probably get the job. I just kind of get in my own way sometimes.
Yeah. Okay. So we can now see that if you didn't feel as critical of yourself, that you might get the confidence you want back. Easier said than done, I know, but it's important to see these areas that you might be stopping yourself from succeeding or engaging in what we call cognitive distortions. These are thoughts that color our perception of the world and make it harder to function. The beliefs you have about the interviewers make it seem like you can predict what they think, that they'll be able to just see that you're not right for the job. But really, you're just assuming that they're thinking like you are about yourself.
Yeah, I guess that's right. I shouldn't just kind of assume how they feel about so much and just kind of give myself a chance to succeed again. Like, it's just hard because all of this doubt I have now. When I'm not here talking about, I forget that I'm even doing it. So then I start to think that it's just the way things are with me.
What if one of your friends came in to talk to you and they told you what you've told me? Would you just believe the things they were saying about themselves?
No, definitely not. I'd feel like telling them about how good they are and talking about all the positive things with them. Like, they're probably just feeling down because things haven't gone their way so far, but as long as they keep some hope alive, there's always a chance things can get better. But yeah, I get what you meant by that. If I want to tell my friend all these encouraging things and I believe in them, then why can't I believe in myself that same way? I guess it's not really fair to myself to be so negative and doubting when I instantly want to do the opposite for all the people I care about.
So how might things change if you no longer doubted yourself so harshly, or if instead you remember what you would tell a friend who was standing in your shoes?
I think I wouldn't be so worried about my next interview. I'd tell myself good, positive things instead of obsessing over what might go wrong. Even though it's really hard, I don't want to feel this way, so I need to find some ways of reminding myself not to be so critical of myself.
Wonderful.